All right, so let's switch it up, and now let's talk about action and just a couple of things from that film that I want to call out, other than my amazing mustache in 2022. Remember what Joel said. People think we can't make change, especially in this climate where things feel like they're not in our control. But you are the front lines in this. And let me explain to you, as somebody who meets with the governor's office and multiple state agencies and the legislature all the time, let me tell you how it works. I'll go into a room and people will say to me, Mark, I've heard this, or I'm getting a lot of calls about this. What should we do about it, right? So Kathy is right. You guys have an opportunity here to come together. You're coming together now. So let's talk a little bit about action. We have Matt and Justin, who created Hunger Surface. Let's give them a big round of applause. We have Robin Peacock, one of our amazing food bankers in the state of New Jersey, serving Essex County. Let's give her a round of applause. And then we have Lisa Pitts, from the director of Hunger Free New Jersey, one of the loudest advocates. You can clap for her. For everything that New Jerseyans need, especially our older adults. She's always, every time I'm at the State House, I'm like, Lisa, you're here again? So she's always there advocating for you guys. So we don't have time for a Q&A, but we definitely want to have a conversation about what action looks like and what we have learned. So I'd like to actually start with the filmmakers, as two people who probably have not been embedded in the work as much as Lisa or Robin or much of this audience has been. Justin and Matt, with your fresh eyes, because our eyes are very tired many times, like doing this work, with your fresh eyes, why did you create Hunger Surface, and what have you learned, and what do you take with you that you think we should all know?
Sure, thank you. So Hunger Surface started, Justin was volunteering with CUMAC, Mark's former organization, and really in the pandemic, unfortunately, it was like Joel said, it was so much in the media of hunger in America, and Justin approached me and said that this is a story that we want to try and help tell for CUMAC, and we quickly learned that it's not just CUMAC, it's not just Patterson, that this is something that's being, unfortunately, on Americans all over the country for many different reasons. So as we started to explore hunger very closely with you, Mark, we learned all of the different silo issues from people that are in your community to seniors to children, people with SNAP benefits, and really the story just kept growing and growing and growing. So.
It was, the original intention was just kind of a snapshot on what food banks and food support systems were going through seemingly overnight in the pandemic. But the biggest thing that we had learned, and as Joel puts it so boldly in the film, is we had no idea that it was such a long-standing, growing issue already, and it was really only getting the media spotlight because of a national crisis. And then it really does kind of go back in the darkness, sadly it's more relevant than ever right now, with numbers continuing to grow. So it started as a snapshot, and then what often happens with documentaries is that the story evolves. We are complete students in this space. We are not the experts here. So we were learning as we were going, with guidance from yourself and pointing us in the right directions on who to talk to. Because it is a complex issue, and we were trying to have this film. This is supposed to be that was part one of a 3-part series. We were trying to, in the next part, explain in a kind of easy to understand way, kind of through explainers segments like that cooking segment, breaking it down, of defining what it is, contributing factors, and then in the third act, let's focus on individuals, both at a grassroots level and at a policy level, that are creating actionable solutions towards addressing this issue.
Can we give Matt and Justin another round of applause? what I want us all to take away from their comments, we can't take our foot off the gas pedal in terms of what our older residents need and what our residents in New Jersey need. These are two of the most active storytellers nationally that I've ever met in my career. They're all over the place, not just in New Jersey. And you just heard Justin say they didn't know, and you've heard Matt say they didn't know. There are still a lot of people in America who don't know what you know, right? And you're in a policy window where action is needed, and the littlest action, the littlest outreach can have huge impact because there's still not enough people, there's still a lot of people that don't know, right? So I want to now transition to Robin. Robin, how many people run a Frontline organization? You're out in community all the time. You're directly working with. You can raise your hands higher. Be very proud of that. Give yourselves a round of applause. So I'm sure you're seeing what Robin is seeing, but hey, Robin, be the Debbie Downer for us. No, I'm just kidding. Could you tell us a little bit about Mend and what you and your team are doing and what you're seeing, and what especially the residents that you serve are seeing?
Yes, but I'll say that Lisa and I already agreed that she was going to be the Debbie Downer and I was going to be the positive one. Yes, so let me start with what I would call two big themes. Well, first of all, let me back up. I was speaking last Friday at something called Crisis Leadership, which sounded really sort of comical and ironic, because I think we've all felt like since 2020 we've been in crisis leadership mode, right? So what we're seeing on the front lines, which should be probably not a surprise to anyone here, is that things have actually gotten worse since 2020. 2020 was like the lightning bolt shock, all kind of shut down at once, but there's been this steady, slow climb of food insecurity and at the same time a decreasing of support systems for folks. So the themes we have seen, since then and even before then, by working with and through community members, is people want access to better quality, culturally relevant food, and it's really hard to find resources in communities. The term we hear a lot is it's a scavenger hunt, and especially for the older adults. Some stats, the Debbie Downer stats. We work with a network of 22 food pantries in Essex County. When I started with Mend in 2015, we were seeing about an average of like 10% of the folks going to those pantries were older adults. Right now it's 25%. And 2 of those 22 pantries have gone from under 50% of older adults to over 75% since 2020. So the numbers are growing, and older adults are specifically being impacted. How much time do I have? I can talk about some good things. I will say, with crisis comes innovation. So the things that are working, and what we're trying to lean more into is what Mark touched upon, which is working through coalitions. There has to be cross-sector, community-level engagement to solve these issues. We have a great coalition we're building in Essex County, and in that coalition, there's an older adults working group. Dorothy's a part of it. Lots of people in this room, and a shout out to Grata Fund who gave us some seed money to get that coalition started. What's happening there is beautiful. It is community members that have experienced hunger. It is nonprofit support folks. It is government. It is academia. It is philanthropy, all in the same room, all working towards solutions. And the solutions are not that hard. It just takes someone to lead the discussion. And the example I can give you is right now there's a project happening in that older adults working group on how do we get information about congregate meal sites more readily available to the community. It's a sad fact that it's like a scavenger hunt, right? It's hard to find this information. People don't know, well, assuming they have transportation and mobility and can get to one of these places, they don't know where to go, they don't know what they need to bring, they don't know if they're eligible. So we're working across the organizations to try and make that something that is a real tangible deliverable that we can push out to the community. The other thing we're doing is something called mobile markets. Again, it's not rocket science, but it's bringing free farmers markets to older adult buildings. It reduces, obviously, the transportation barrier, but it does something else really beautiful, which is instead of making people go wait in line for food, it brings a sense of dignity and community. So we show up, we work in partnership with the buildings ahead of time to understand what the food needs are of the residents, and we commit to being there once a month for a year. So consistency is very important. And as we work through the partnership, we learn what the residents' food preferences are. We're able to adapt to those food needs, health needs, and then we're able to bring in other resources, SNAP outreach, medical screenings, et cetera. It is a way to build community and tackle an issue that's working. The biggest challenge is capacity, right? It takes money to do it. We purchase most of the food that we bring because we pride ourselves on being very responsive, but we know it works. So surrounding sort of older adult community spaces with resources to just make it easier overall. And I'll stop there.
Thank you, Robin. Let's give Robin a round of applause. So recap so far, there's not enough people in America that know about our work, your work, and what older residents are going through. And we need to be able to get their stories to people that can tell the story in a very powerful way. And while that's happening, the need is growing. So community needs and community champions, we all need to find each other, right? We need to find each other because Robin is right. It's not rocket science, but it's incredibly hard to herd the cats. Y'all are busy, right? Y'all are busy, but you all need capacity. So you all need to find each other because, I guess you're the Debbie Downer. Lisa. So Lisa, I've known Lisa, geez, I think I met you in like 2017. She's active on the Hill. She's active in the State House. She's active with our state agencies. And I'm sure she's tracking what you guys are tracking. There's a lot of changes at the federal level that are very concerning. And I've especially emphasized to the Speaker to the Speaker of our General Assembly, why these changes concern me is they're going to show up as an economic mobility and public health issue on the front doors of our frontline organizations and the organizations that serve our residents. So Lisa, can you just give us a call to action? What are you tracking at the federal level? What should we all be really looking at as well? And what can we collectively do to make our voices heard?
Yeah, so I feel like every place I go lately, I am the Debbie Downer giving these updates on what's happening on the federal level, but I do think the hope really lies in all of you in the room today. And when I look out and I see all the faces here, if every person that's here today committed to reaching out to your member of Congress, that would be a big, loud, booming voice. So we do have hope in the power of the people, which I really do believe in. So what we're tracking on the federal level is, and as I'm watching this fantastic film and thinking about how the government responded during the pandemic, right, and really shored up the safety net, recognized that food insecurity was a huge problem. We were feeding all of our kids for free in school. We were maximizing SNAP benefits. We were allowing for grab and go for families to come and get meals and take them home. We were doing all kinds of things that really showed the power of good public policy and how the government can respond in times of crisis and in need so that nobody in our country goes hungry. As Robin said, and it's true, and we hear it from emergency food providers throughout the state, hunger did not go away when the pandemic ended. Most of the food pantries that we speak to are reporting higher rates of participation, higher levels of need than they did even during the height of the pandemic. So even though it might not be getting the media coverage that it was, we might not have the optics that we had, and it's not in everybody's face all the time, it is still a real and significant and growing problem all around the country, and certainly in states like New Jersey. So how is the government responding now? We are sort of doing the opposite now. The pendulum has swung, and there are a lot of really potentially harmful cuts being proposed to SNAP, which is the absolute first line of defense against hunger and food insecurity in our state and across our nation. And we should all be extremely concerned because a lot of the proposed cuts will have a profound impact on our older adults. So the House Agriculture Committee met this week. They marked up their bill. They're being called upon to make over $230 billion with a B dollars in cuts, most of which will come from SNAP. They actually voted their bill through, and it actually makes more than $230 billion in cuts. How will they make this magnitude of cuts? There's a couple of different proposals. One of which is, so there are work requirements for SNAP. There always have been, work for food requirements. They want to raise the age up to 64 years old. So that is one very specific policy change that will have a significant impact on our seniors. Right now, anybody over the age of 54 is exempt from those work requirements. Now it will go up to 64 years old. And I don't have to tell anybody in this room what kind of a challenge that will bring to our older adults. We know that about 1 in 10 older adults in this country, in New Jersey, experience food insecurity. And we have about 8 million seniors, older adults in America that rely on SNAP. And we have about 175,000 older adults in New Jersey that rely on SNAP. And seniors are probably the most underserved population by SNAP. I think we only serve about 63% of all eligible seniors are even getting SNAP. So there's a real need for us to be improving access to SNAP for seniors and not implementing policies that will make it harder for seniors to get this vital nutrition assistance. One of the other proposals, in addition to the work requirements that will lead to these huge cuts in SNAP, is to shift some of the cost for SNAP to the states. States do pay some of the admin costs, but all of those SNAP benefits that come into the states, that come into New Jersey, that help stimulate our economy, that help people purchase food, those are all federal dollars. Now, to save, to put through some of these cuts, they want to shift some of these costs to the states. That is going to create a huge crisis for all states, certainly for New Jersey, because what that is going to mean is that the state will probably have to either cut services and or raise revenue to meet some of those expenses. So again, it could impact other services that are available to seniors if they have to be cut. And then one of the other proposals that is out there is to limit under the Biden administration, they were able to give a little bit of a boost in SNAP benefits by adjusting what's called the Thrifty Food Plan, which is how SNAP is calculated. This would basically put a freeze on that. So what that means is that people would not see benefits go up really at all to be in line with the actual cost of food, which we all know has gone up significantly over the last couple of years. And so it basically means a loss of benefits. So they're estimating about a loss of $1.40 per person per day, when the average SNAP benefit is about $6.40 per person per day. That is a significant hit. So we will see a reduction in benefits. We will see people fall off the rolls and lose their SNAP benefits. This is going to have a big impact on seniors. So what can we do? I'm shifting from Debbie Downer to
Go, Lisa.
Harriet Hopeful.
Do it in song.
Harriet.
Just kidding.
I don't know why I said Harriet. That's such a Harriet Hopeful. What I would say is the next 2 weeks are going to be really critical for our members of Congress to hear from all of us. You can certainly reach out as a private citizen. If you cannot do so, professionally, you can certainly reach out. So I would say the call to action is please, please, please take the 2 minutes it takes to call your member of Congress and say, I'm very, very concerned about these proposed cuts to SNAP and how they will impact everyone in our communities, but certainly our older adults. It really does make a difference when they hear from you. Like Joel said in the film, and one time I was at a meeting in one of the members of Congress's offices, and his legislative staffer said to me, if the congressman hears from 10 people on an issue, 10, he pays attention. I said, so the good news is it doesn't have to be a big, giant, heavy lift. The bad news is it shows you how few people really weigh in on such important issues that impact all of us, right? So please, please, please exercise your power, use your voice, reach out to your member of Congress today. You could have a homework assignment for today, or next week, and let them know that you don't have to be a policy expert. You oppose any cuts to any nutrition assistance programs, any cuts to SNAP, no cuts. Let's work together to save SNAP and all of our critical safety net programs. Thank you.
Let's give a round of applause to Lisa. So just to recap as we finish out this session. So we need to tell the story more, and your stories and what you're doing needs to get to storytellers, and it needs to get to our members in Congress. I will also throw in, Lisa, and I'm sure you'll agree with me, reach out to your state legislators as well. The speaker cares about your work, right? And he wants to hear from you, but it will require extra work on you guys, which is basically picking up the phone and leaving a message. We also know that form letters and the email form are not as effective, and we have a major 2-week window over here, but also in New Jersey. As you head into the gubernatorial race, like what Kathy said, you need to make your voices heard for older adults, because as Robin has said, it's continuing to rise. My old organization that you saw on there, I thought it was really bad when we were serving 3,800 people a month, a majority of whom were children and older adults. That same organization now serves 7,000 people a month. This is a call to action. This session is a call to action where we need to find each other, we need to support each other, and don't waste today. Don't waste today. Find your tribe. Remind yourself of your why, and remember, you're not obligated to complete this work, but neither are you free to abandon it. Let's give our panelists a round of applause again. Thank you so much for all the work that you guys do. I'm going to turn it over to Kathy.
Thank you so much. I feel bad. I drag you guys down here for early in the morning, and then I'm going to chase you off stage. No. Please stay. I hope you can find them. We are running a little bit late, but that's okay. So the breakout sessions are going to start at 11. We're going to make up the time at lunch. It's all good. So you can grab your coffee and run. But please, we'll be able to share the link to the film and share their information. If you need help crafting your message, or what committee to go to, or shaping your language for how this impacts older adults, please feel free to reach out to us in our office, or we can connect you with them. We are happy to help you with that language, because this is very, very important. And the last thing is, on the survey report in your packet, on the very last page, Audrey Meng, our intern from Rutgers, did a great job summarizing affordability, and she has also started drilling down into the data on food security, so we can, when we get into that more, we can get that to you and share it. But please, reach out if you need help crafting your message. Thank you, guys. This was great.